60-year-old farmer is brought into the emergency department with organophosphate poisoning. How would this form of poisoning be treated? Answer. One is respiratory support of the farmer by mechanical ventilation, blockade of the cholinergic receptor by the administration of atropine, and the activation of the enzyme cholinesterase by the administration of pralidoxime iodide. Question. Which four principles underlying the management of acute clinical overdose should be used? There are four principles underlying the management of clinical overdosage. One is life support, client assessment, drug decontamination or detoxification, and fourth one is drug neutralization or elimination. Name the agent used in the treatment of poisoning by cyanide. Amyl nitrate, sodium nitrate, and sodium thiosulfate. Name the agent used in the treatment of poisoning by lead. Penicillamine. Name the agent used in the treatment of poisoning by mercury. Penicillamine. Dispositional antidotes act by altering the metabolism of the drug or by increasing the excretion of the drug. To increase the renal excretion of an alkaline substance, what you do? Acidify the urine with an infusion of ammonium chloride. The use of ethanol in methanol intoxication is an example of a dispositional antidote. What is the antidote for copper poisoning? Stomach wash with potassium ferrocyanide 1% solution in water acts as an antidote by forming cupric ferrocyanide. Calcium EDTA or BAL is the recommended antidote. Maintain electrolyte and fluid balance. For what purpose Ipecac syrup is used? To induce emesis. When gastric lavage should be performed? It can be performed 4 to 6 hours after intoxication when hepatic recirculation occurs. Chelating agents include British anti-levisite and succimer. 3 major signs to monitor in the poisoned patients are cardiovascular, respiratory, and central nervous system. What is the most effective way to reverse arrhythmia on the poisoned patients is to give sodium bicarbonate by IV, give lidocaine by IV. Breath that smells of bitter almond is indicative of intoxication with cyanide. Delayed toxicity can include development of cancer, damage to CNS by organophosphate, damage to the CNS by organophosphorus insecticides, toxic damage to the liver can be reversible. To manage unconscious poisoned patients, what can you do? Administer CPR, transport to clinical facilities, do not remove stomach contents by emesis.